you this morning Ms. Susan Johnson, who is the Regional Director of the United States Department of Health and Human Services for Region 10.
Wow, I'm glad I came here this morning. That was wonderful. Thank you very much, Dr. Young, and thanks to all of you for being here this morning. I'm just going to live on those words for a while. That was kind of over the top, like the day out there, I think. I really appreciate the chance to come back here, and I felt like a little homing pigeon following my MapQuest when it said south something, take a slight right, and I thought, wait, I've been here before. I know it's right over there, and here I came. I had the pleasure of being here one evening a number of months ago with Senator Kaiser and Rosa Franklin, and lots of people talking about my favorite subject, and hopefully after today, one of yours, the Affordable Care Act. But I should start by reiterating what a great privilege it is to serve in this position representing Secretary Kathleen Sebelius and President Barack Obama. In fact, I was on the phone with both of them yesterday, and it really is quite stirring to hear someone announce, ladies and gentlemen, the President of the United States, when you pick up the phone, and it just gives you that moment of, wow, you know, and we all need those wows in our life. But I just want to share with you the great enthusiasm I have for this job, and it's been wonderful to travel around to Alaska, Idaho, Oregon, and throughout Washington. I've become particularly fond of Alaska and the many tribes up there that I've been working with. I think I made 14 trips in about 8 weeks. In fact, the Secretary came and spent an entire week up north of the Arctic Circle last August, and we had an extraordinary visit to see, talk about barriers and gaps, what it's like to have to fly 250 miles for $4,000 when you have a chest pain in Barrow, Alaska, to get yourself through Fairbanks and to Anchorage. It's not like just taking a cab to St. Joe's. So quite an experience I've had in the past year and a half, and it's great to be with you today. How many, I like to take a little, I used to teach 6th grade, so I always like to know who's sitting in front of me, and I'll probably wander a little bit because I want this to become more of a conversation soon, and I'll stop talking and we'll talk together and take questions and just have a conversation. But your theme is so incredibly apt, I think, for what President Obama fought for and what Secretary Sebelius and this administration have brought to us all in terms of the Affordable Care Act and what it does to remove barriers and bridge gaps, help health disparities, improve access, remove the incredible barriers I'll talk about that were in our life in terms of accessing insurance prior to the Affordable Care Act. But before I go into a little bit of a conversation about how I see the bill, the law, now, I'd like to ask you, how many of you feel that you know pretty well what the Affordable Care Act is, what the new health reform law is? Anybody feel pretty, on a scale of 1 to 10, 4 to 6, something like that? Yeah, okay. How many of you feel like it's a good thing, just to get a read? How many of you think it's a bad thing? You can put your hand up, it's okay. I deal with this all the time. How many of you aren't sure if it's good or bad? Okay, great. Well, it's good that we have this time to talk today. And I'm a visual person, as you heard. I do attempt watercolors. Some of them are okay, some not so good. And I like to sort of have a picture. I don't know, you've learned learning styles if you're an auditory learner or a visual learner. I doodle all the time. I have to sort of see it and have a metaphor for what it is I'm trying to understand. And so I'm going to give you a picture that I carry with me of the new health reform law. And I'm older than I think almost everybody here. But how many of you remember Parcheesi? Okay, great, good, all right, stay with me now. So Parcheesi, I remember the shakers. I remember those little shakers and that great board that had those sort of geodesic kind of things in the middle, and you went around and you went up the little chutes, and you had to get all your little 5 men or 6 men up to the center, right? And you shook the shaker, and I love that sound. In fact, I used to do it so long, my brother would say, "Roll the dice, Susan." I said, well, I like the sound. But anyway, you'd roll the dice, and you'd figure out how you were going to move your little men out, either 1 all the way around or 1, 2, and 1, 2. But so say you rolled and you saw 7, got 7 dots. You'd start to roll. If this were the board game of life in health insurance and health care before the health reform law, stay with me, you'd roll and you got a 7, you move out 7 spots, and you'd say, okay, your turn, and all of a sudden you'd see your little man pull back 3. What? You'd move it ahead to 7 and pull back 3. Why? Because you didn't know something that was in your insurance plan. You had met an annual limit you didn't even know existed, and you were pulled back. An unwritten kind of rule that was guiding your insurance. So you'd roll again. You'd say, well, that's funny, I didn't know that, in that tiny print. You'd roll again, and you'd go 4, and all of a sudden the dots had changed to 0. No dots. They'd all be erased. You'd think, what? Your little man would go all the way back to start. Why? Because you'd made a mistake. When you filled out the form for your insurance, it's called rescission. You'd lost your insurance, maybe right in the middle of chemotherapy or some treatment that you desperately needed, but you were pulled back and you lost your insurance because the insurance companies prior to this law could just take it away from you because you made a mistake. You checked a wrong box. Last example, you roll, you got 8. Double 4s, you're moving out. But you know what? Your little guy won't move. That little bored person won't move at all. You say, what's with this? Turns out you had a pre-existing condition you didn't even know about. You can't get off square one. You can't buy insurance. You can be denied insurance. You have a child born with a cleft palate, asthma, diabetes, autism, like my daughter. You can't move off square one. And that was the way the world was. It was a bad board game. It was unfair. It was full of gaps, full of barriers, full of unfairness, and the new reform law said enough of that. The goal here is to have as many people be as healthy for as long as possible. We want to improve access. We want to improve coverage. We want to bring people on to health plans, not keep them off. We want to restore a focus on prevention before a disease takes hold and causes real problems like a cancer. And we want to make you, who own that insurance plan, able to know what's in it and have it be fairly disclosed to you. So in the course of the next few minutes, I bet at the end of this, you would be able to, if this were a class objective, you would be able to list at least 8 barriers and gaps that have been bridged and broken because of the health reform law. Maybe you haven't yet experienced them, maybe you haven't yet experienced them personally or in your family, but they're there, safeguards for when you need them, and we'll talk through them. So I've spent a lot of time just giving you this visual image, and I mentioned just briefly prevention, but I'm going to come back to that as a key focus for the goals of the Affordable Care Act, of this new health reform. And I'm going to come back to accountability, because we all share in our future and what we do and choose to do to stay healthy or not. We choose to smoke, we choose to drink, we choose to eat. We can't choose whether or not to breathe too much, but we can choose how we exercise, if we exercise, what we do to optimize our health. And we can choose to really have health plans incent that, make us want to do better. And that's happening as well. So a couple of items when we look backwards to the health reform law will be 2 years old, walking and talking, and a lovely little 2-year-old, wonderful law in March. And when it started, some of the things that have come into effect that are affecting your lives or those you know are those pieces on the board game picture that I gave you, and others. Kids under the age of 19 with pre-existing condition can't be denied that coverage anymore. That little man that kept being pulled back to start. That cannot happen. And when we get to 2014, pre-existing condition goes away for the rest of us. So that incredible unfairness of needing to get to health insurance and it being just out of reach because of this sense of pre-existing condition, kind of like original sin in my mind, that goes away. Young adults, maybe you've experienced this, and I'd be interested to know if you or anyone in your family has, under the age of 26 can now stay on your parents' insurance, especially during such uncertain times with the recession, the difficulty of finding A, a job, and B, a job with insurance. My daughter is still on my husband's insurance plan, and that's really helpful because it's taken her a lot longer to get through community college than we thought, and she's 23, and she has this form of autism. So, big relief for us. Personally, she can stay there. That was huge, and I'm just wondering, how many of you know or have experienced that in your own life, your own family, or know someone who has? Good, because it's still a best-kept secret. And we don't want best-kept secrets. We want people to access that, so help spread the word. Until age 26, you can stay on your parents' insurance. There are other things about prevention that are very specific. New insurance plans, because of the law, have to cover preventive services without co-pays or deductibles, as does Medicare as of last January in 2011. And I heard a story just maybe a few months ago on the Olympic Peninsula, CEO of a hospital. His mother had put off having a colonoscopy because of the charges that she would have to pay under Medicare before the law, before January 2011. It went into effect. She finally thought, okay, no barriers for me. I got to go do this. I better do it. Well, guess what? They found some cancer, but they found it early enough that she's going to be okay. But had that not been there, had she put it off, had that barrier been there, had that gap occurred, and she thought, I'll wait another year, maybe it'll be less, I don't need to do it now, nothing's hurting, cancer could have grown and been more of a problem to her health. So this is not just a law of words. It's a law of lives. Those words reach out and touch lives, save lives. I hear stories all the time of, thank goodness for that law, it saved my blank, son, daughter, grandmother, aunt, friend, because of the access that was now possible. The seniors under Medicare also, in the past, benefited from the donut hole. I know we were here talking about that when I was here that evening, and maybe you've heard of that and have parents or grandparents on Medicare, but there was a gap in coverage, especially around prescription drugs, and everyone who went into this hole where there was no more coverage got a $250 check to say, that was a problem and we're trying to fix it. And over 35,000 seniors in Washington got those checks. Then in January 2011, it changed to give a benefit to those same people who come into the hole where there's a lack of coverage to be able to have a 50% discount on brand name drugs. And that is saving lots of people, 37,000 people, a lot of money as of January 2011. So, in fact, my note says $559 is the average savings per person. Well, you multiply that by all the people across the country, and that's an incredible gap that was bridged by this one provision in the thousands of pages of the law. And it's not just people and families, small businesses. We hear a lot about small businesses struggling now. Small businesses get a tax credit, and they're eligible up to 35% tax credits. 106,000 small businesses in Washington can avail themselves of that. There's an early retiree preference. 69 Washington employers have been helped by that, so that they're able to receive funds and credits to help continue to provide insurance for retirees. And something we heard was often being stripped away during tough recessionary times. Community health centers, and you have some fine ones here in the Tacoma area, they received over $36 million to expand services, and their capacity to get ready for 2014 when Medicaid will expand and have services and coverage for more and more people. The part I like about the law is that it goes kind of in these concentric circles from you at the beginning in the center, a patient-centered view or a person-centered view for access, to concerns of the family, like the 26-year-old or under 26 able to stay on their parents' insurance, to seniors or elders in the family being cared for in a better way, to then the biggest expanse, to the community. So for too long, we've said there's health insurance in a box, there's healthy behavior in a box, and then you live in your community and you kind of wander around trying to be healthy when you have no sidewalks, or you have no parks, or you have no safe parks, or you have no fresh food to go buy, you have no farmers markets, you have no pea patches. And there's a part of this bill that puts billions of dollars into a preventive fund to help entities such as Tacoma Pierce County get funds for community wellness programs, to make sure whatever the community wants and needs, not a top-down thing, we want sidewalks or we want pea patches, we'll apply in this grant to do that. We'll focus on the increase in smoking. We'll focus on obesity. We'll focus on fresh food and obesity. We'll do something with schools and non-smoking, or we'll bring vegetables to schools. All of that is possible and is blooming across the country due to the prevention fund that is funding not the individual, not the family, but communities to make those environments healthy. Huge. And there are those in Congress who want to take all that money away. They say it's silly. They say it's just going to do stuff that the community should be doing anyway. Well, I don't know if they've heard, but it's tough out here. It's tough in a recession. Small nonprofits are struggling. Grants aren't what they used to be. Everyone is competing for the same good stuff. And this is a lifeline, like that show I'm going to call a lifeline. This is a lifeline to communities to say, you need to be healthy places for all of these flowers of healthy stuff to bloom. We're going to help you with these grants. Back to those insurance, that box for a minute, and insurance companies and the bad board game. This law now corrects that stuff. And it makes insurance companies unable to deny coverage because you need it the most, because you're born with a pre-existing condition, just when you need it, when your brand new baby can't have it. That meanness is gone, illegal. And where does that affect a lot of people? In health disparities, in that huge gap between blacks, whites, minorities, majorities, the 99%, the 1%. It makes everyone start at a level playing field in terms of that access. It also says to insurance companies, you can't hide things in the small print anymore. You've got to say it in a way that's understandable so people know what's in there. And I don't know about you, but on a lovely Saturday when I'm thinking about, I should take my car in, I don't pull out the car manual that's this thick and just say, I'm just going to read it again because it looks fun. I mean, that's like, who really reads all of that fine print of an insurance plan? You sit down, cozy up to your fire and say, I think I'll just read my health plan tonight. And it's impossible to really get it. Well, now it has to be simplified so that you can get it. Just like we've done with all kinds of disclosure, whether it's contents of cereal and sugars and all that, but to make it available to you so you know what's in it. That has to happen. And No more can insurance companies do two things. They can't raise your rates suddenly to like 25% and say, too bad, we need that because we know best and we're competing and we need to have that margin for our competitive well-being, and put up or drop out. There's an oversight now. Insurance Commissioner Kreidler in Washington State here. In other states, it defers to the federal government. Look at that with incredible scrutiny to say, what is that rate all about? What is that increase all about? Is it justified? Is it justified why? When their margins are already X amount and when they already have X amount in the bank, why is this needed? And it can be turned down. Good thing. Good thing for consumers. Makes it accountable. Those plans have to be accountable for their actions. They also have to disclose and show you who've purchased this insurance that 80% of what you're paying for is actually going to services. Not to advertising, not to executive suites, not to fancy whatever advertising media campaigns, buy this insurance, not that. 80% has to go to the services, 20% can go to the rest. That was never in place before. And if they're found to be out of compliance, money gets turned back to you. So why did the insurance companies fight this law so hardly, so much? Think about it. They're being watched now. There's accountability there for them and for you. The exciting piece now, as we're finally, it feels like 2011 went on for a long time, as we're finally in 2012, the focus of what new pieces of this law turn into even a broader concentric circle, and say that not just is this law about access to insurance and all those circles I mentioned, you, your family, seniors, the community, but it's also about the care and the quality of care you receive when you need it. And it puts in place not requirements, but incentives for health systems, and you have several here in Tacoma that are great. I'm going to visit with some later this afternoon. Options for them to pilot and create even better ways for systems to work together, to talk to each other, to make sure that you as a patient in the center of that care actually have teams working, sharing information, knowing what medications you're on, teams that can sort of seamlessly bring the specialist to you that you need, and if in this new creation of how to best care for patients, the system saves money, they get to save some of it and keep some of it. It's called accountable care organizations, or you may hear ACOs. So there are lots of new opportunities for big and small health systems to work together in better and more creative ways, and with the incentive that if they do better, keep more people out of hospitals, return people to health faster, coordinate care better, they'll be able to save funding. They'll also be getting bonuses for reporting those things. So there's an incentive to share the information. Again, if you've got a great thing going, make it a best practice. Share it, not keep it to yourself as a best-kept secret. The hope is through part of CMS, the Center for Medicaid and Medicare Services, all these great things in Tacoma will be shared with Salem, will be shared in Alabama, will be shared in Milwaukee, so that people know and can benefit from the efforts of others. Fewer secrets and more sharing. When we finally get to 2014, which doesn't feel that far away, we go back to making access more accessible for everyone through what you've probably heard of as exchanges. And as my daughter would tell you, I'm very bad on the internet. I was trying to look at flights the other night to go back east for a friend's daughter's wedding, and I went to Travelocity, and I went to Orbitz, and then there was Kayak, and then there was something else, and I thought, yikes! And so I'm a little nervous about this personally, but the good thing is there's going to be similar constructs in every state for you to be able to say, Okay, I'm a single mom and I've got a child with a pre-existing need. I need to be able to have this. You're going to be able to go to your computer, the Washington State Exchange, punch in what you need and have it come back to you, kind of like Travelocity. Here are your options. You can pay this much and have this coverage, this much and have this coverage. You can flip to another screen and see what kind of opportunities there are if you're a small business, because now in 2014 you can pool together with other small businesses like a big business and get cheaper rates. So they're going to be, again, in this disclosive effort, more sharing of information, able to be accessed through a single point, through a health exchange, to know what's available to you. There's also going to be a state-selected benchmark plan to say that there has to be a certain level of essential health benefits, or we in the federal government, we love these little acronyms, EHBs, to say what is it you're going to be buying. It's got to have this kind of contents. So each state might be a bit different, and Washington State now has a great exchange board, very active, as I mentioned, Insurance Commissioner Kreidler, and they're meeting now already to plan all this. They will be taking it out, I'm sure, to communities to preview, and they will be developing how this access will occur and what that benchmark plan will be so that you can be learning about this as it unrolls before 2014. There also will be, as you've probably heard, the requirement that there's no free lunch anymore in this world. That if you don't have insurance and you fall off a ladder painting a house and you end up being flown up to Harborview because you've got a neck injury that's significant and you spend 2 weeks there, that's a huge expense that Harborview now puts in their charity care bin, but all the rest of us pay. It gets added to everyone else's costs in the hospital for insurance. And so now the requirement will say you either are going to have to purchase insurance, or if you're at a certain level where your income is difficult, we'll have credits for you to go to the exchange with a chit to say, I make so little money, like maybe $13,000 a year, but I've got now this federal chit I can spend to help me buy this plan. And it says to all of us, we're all in this together. We're no longer going to say it's okay, like we did years ago, to ride a motorcycle without a helmet, because if you fall off and have a brain injury, we're all going to pay for that. Same with purchasing insurance. We want everyone to have access to be able to be cared for, but we all have to have a commitment that it's some of our responsibility. So that is a piece there as well. There are also, in terms of gaps, and I mentioned disparities, insurance companies now can charge women higher premiums than men. They live longer, and that's just unfair. That went away, too, with this law. So back to the themes, and then I'm going to stop talking. 20 minutes is enough for anybody. And just to say that when I go back to the main themes, what I get excited about, and I've spent my life working on social and economic justice issues with labor unions and in my work at the Health Commission, that this law does, I think, huge things in terms of social justice issues. In fact, personally, I would say it's probably the most important piece of legislation since the Civil Rights Bill, because it creates a floor and it says we are all equal in terms of the need and the necessity to have and to be able to access insurance, to be able to access quality care, no matter where we live. There should be a standard like equality and justice for all and the pursuit of happiness, and now health care. It's not something that you can be kept off the game board because you were born a certain way. It's not something that now you can be charged more for because you have a condition or you're a woman instead of a man. It's not something that you can be vulnerable to suddenly losing when you need it the most because you didn't know you checked a box wrong. And it's something that makes it more possible for more businesses to offer insurance to more people because of the tax credits. So somebody once said to me over a year ago, Susan, I don't know about this law, you know, thousands and thousands of pages. I mean, too much. And I said, no. Boils down to 6 words. You can keep with you, just like the picture of Parcheesi. With this law, now, more people than before will be able to get the right care at the right time and in the right place than ever before. The right care, preventive focus, before the cancer spreads. The tests will be without copays. The right care, the right place, in a patient-centered, quality environment, not in an emergency room that should be kept for true emergencies. And the right time, when you need it the most. You don't lose it. It's there for you. It endures, and if somebody's tricking you and spending more on advertising than on the care and the contents of your plan, they'll be called out. So, it's very simple to me. Right care, right time, right place, those concentric circles, the Parcheesi game, and I bet now you could name barriers and gaps that have been bridged and spanned because of this bill, so this law. So I hope that was helpful to you, that maybe there'll be more hands in the air now if I say, did you learn something from that you didn't know 20 minutes ago? Was that helpful? It's feedback for me. Okay, great. Still questions? We want to hear from you. So feel free to come up to the mic, and before I end, I do have a handout, but I don't want to pass it out now because you'll all be reading it and not listening to each other. So I will pull that out in a minute, but thank you for your attention.
Thank you so much for your explanation. I have a question, though. I just recently was able to purchase health insurance after not having it for a couple of years. And according to my health insurance plan, which starts tomorrow, I can't access, or I won't have any reimbursement for a condition that was pre-existing for 9 months. I have to wait 9 months in order to get any kind of financial help to deal with this condition. Are you saying that starting in March, that's no...
Whoops, what did I do?
That that's no longer the deal, or is this something that was already in effect that they're not supposed to? They didn't exactly deny me, they just said I couldn't do anything about that for 9 months and get any kind of financial help for that.
Yeah, I'll give you a number to call in the insurance commissioner's office to double check on that. They're calling it a pre-existing condition?
Yeah.
Yeah. So if we were in, this is loud, isn't it? If we were in 2014, they couldn't do that to you.
Right.
It goes away for everybody. But
so that's
for
2 years.
Right. So for now, I believe they can do that, but I'm going to give you a number to check on that.
Thank you.
And yeah, because there are lots of ifs, ands, and maybes. If it's a new plan, if they change the contents of the plan, if they're discriminating against you. So I'm going to give you this number.
I have to run back and get my pen. Hang on a minute.
Okay. I'll hold it right here. But everybody, with your pens out, 1-800-562-6900. They are great, and they'll be able to help you with the specifics of that situation. So I'll give it to you again. It's 1-800-562-6900.
Thank you for coming in. In regards to the 20% maximum, the 80% towards care, 20% maximum overhead, I know that there was a battle and an executive decision that excluded, that the insurance companies were looking to get certain expenses excluded from that 20%. And that it was an executive decision that like advertising would be included in that. Which opens the door, though, to changes in the executive branch taking that away and allowing more exclusions to that. How robust is that part of the law as we move into the future?
I think it's pretty clear, and I don't think it's that changeable. Any decision like that follows in a regulation that has to sort of codify the decision. So that has to be re-reviewed and reissued, and there's a notice factor under federal law and the like. So I think it's very clear. I don't have it off the top of my head, but whatever is considered administrative will be defined. I mean, there always are word nuances, right? We live in a world of attorneys and words, and may mean may, or may mean shall. So all those things are subject to, of course, reality checks. But I think we're in a pretty stable environment there.
Thank you.
I just want to get a little bit of clarification, but you said that in 2014, when the exchange opens, did you say that Washington would be entering that exchange, the state itself?
Yes.
With its own plan?
Its own exchange, its own constructed sort of construct of how you will be able to access the varieties of insurance available to you. States have the ability to create their own state exchange, or to default and say, we don't want to get into that. Then the federal government will come in and create a state exchange. But Washington has received grants for planning and for moving ahead with the design phase of the exchange. There's an appointed board. Margaret Stanley is the chair of that board, and they just had their first meeting, I believe, 2 weeks ago. So yes, Washington is fully on board to have an exchange up and ready, and in fact, they have to have certain benchmarks by, I believe, the end of this year.
The state will create the exchange, but will the state enter its own plan in the exchange?
Meaning its own plan, meaning?
Healthcare plan.
Well, they will pick a benchmark plan. There won't be a state plan like a state employee plan.
Okay.
But they will pick a benchmark plan that's in the individual and small group area, and they will say, we think this is emblematic of what should be the contents of coverage based on 10 areas that HHS issued, like preventive services, early maternal care, and the like. And then Washington will say, we're going to have this be our model, our benchmark.
So that will be the template for any insurance company that chooses to offer services in
In
Washington?
the exchange, correct.
Okay, thank you.
Do you know how the restructuring will be within our state as CDPs and mental health counselors, like within the community health area? Because right now we're licensed with the Department of Health, and I think it's all going to need restructuring with this new healthcare law. Do you know what that might look like, or?
I would think that that would still be the domain of the state for licensure, because states vary in terms of expectations and requirements. There may be more disclosure of what's the difference between the acronyms you mentioned, CDPs and licensed mental health therapists and so on, but I do not have reason to think that the federal government is going to come into that level and restructure it.
Okay, thank you.
It's my opinion that the insurance companies are only half the problem. With the for-profit medical industry, what are the new laws that are coming into place? How do they control the rising costs of that part of the overall picture?
How does who?
The new laws that are coming in place, how will they affect the medical industry's rising costs? I mean, as expensive as it is to get insurance, is one of the major parts of that. It's because the medical industry is, especially the medicines and all that, are just really shooting out of price range for average Americans.
Correct. Well, 3 areas I'd highlight. One, let's focus on prevention. When it gets traction, it'll take a while, but when it gets traction, it will drive medical costs down because diseases will be caught earlier, people will be healthier, and that will slow that cost curve. That will take time, but it will happen. The second thing is that we have retrieved billions of dollars through Medicare fraud and abuse activities. So people out there now scamming seniors with medical devices or insurance. Right off the bat, there were people saying, give me your social security number and I'll help you sign up for Obamacare. There is no Obamacare, first off, and never give your Social Security number to anyone. But they scammed billions of dollars with that kind of thing right off the bat. That has now saved a lot of money. And thirdly, the incentive focus on patient-centered care that I mentioned that hopes to incentivize and will accountable care organizations to save money will drive down the cost. So no longer will systems coming together each have to have whatever the latest device is that costs billions of dollars. They can share it in a system, in a new approach to say we'll work together. We don't each have to compete by having whatever the new billion-dollar machine is. We'll save it, we'll share it, and we'll focus on the care and the outcomes. So there will be payment by outcomes, not by how many tests we did. So I think those 3 or 4 areas you'll see drive down the cost in the medical system, as well as the focus we've had on the insurance system. Thanks for that question.
Good morning. Thank you for your information. I have actually 3 questions. Are there any laws against institutions who will not see their patients if their bills are not paid in this plan?
An emergency room is always open to anyone regardless of the ability to pay. Unfortunately, because of the problems in accessing insurance and the correct pathways through community health centers and your own primary care physician, too many people have ended up in emergency rooms. But there's a law called UMTALA. It's a series of letters, UMTALA, I believe. But it says that no one can be turned away from an emergency room for lack of insurance or inability to pay. So that doesn't go away.
Okay.
The system just tries to redirect more access points for more affordable insurance for more people so that the emergency room stays available to people who truly have emergencies and not ear infections, for example.
But some clinics are also turning people away if they're not paid.
Right. Community health centers, FQHCs, federally qualified health centers, they have to accept people on a sliding scale that can be set by their own board. A private clinic does not. A private clinic still can turn people away, but community health centers, which I mentioned have been funded to more and more expanded capacity, will be there with that same mission.
Okay. My other question I had in regards to the exchange, when you talked about the exchange program where individuals could create their own program based on like pre-existing conditions and their needs, what happens if someone comes out of what has been created? Would there be an additional expense? Will they have to be charged more? Let's say I create a program and my existing condition is asthma, and then I'm diagnosed with something else after I created an existing program. Will there be an additional charge? How will that work?
Let me clarify. When you input what you're looking for, that's just to get you to an array of plans. It doesn't lock you into what you put in. It just says, as a threshold, these are the 3 most important things to me. But you could find that you had diabetes later on. Doesn't mean you fall out of the plan you chose. It just meant that those were the signal sentinel pieces in your mind that you wanted to help you in terms of a choice sort. But you can
You're not locked into that.
Yeah, no. And in fact, you can, like Travelocity, you can say you want to, I mean, I'm guessing, but this is what people are talking about with the exchanges.
Yeah.
We'll see when they actually do it. But you can say, shortest flight, fewer stops, or, largest chairs. I mean, you can put in whatever it is you want to sort on, but it doesn't lock you into that. It's just a portal.
And my final question is, what is the administration doing to bring, maybe some resistant or unwilling parties aboard? Because as I look at this plan, I'm sure that there are many parties that benefit to the broken system, like pharmaceutical and specialists, and even some institutions. Are there any incentives to bring them aboard so there'd be less resistant and decrease the cost for consumers? Specialists will, I can imagine maybe increase their costs because their patient load will decrease with preventive care.
Right. Well, these accountable care organizations have that as their mission, to try to review and reconstruct a system based on savings. So if you want to save more money and yet have higher outcomes and have to achieve that to keep some percent of the savings, that's an incentive for you to figure out, am I going to pay my primary care doctors more because that's the first level of touch with potentially prevention, as opposed to specialists, or how am I going to bring the system together? Yes, so the accountable care organizations hopefully will come up with models. There's also a new part of CMS called CMMI. It's the Center for Inventions, and I just lost the word, but they're doing creative grants saying, bring us ideas that, again, we could share with Alabama and Milwaukee and everyone else that you think will save the system money, but produce higher quality and lower cost for people who are in the system, and that's being incented. The one piece that I think goes to some of the cost pieces that was not able to be negotiated into this law is the whole tort reform. You know, the suits and the malpractice, the ability to be able to bring a lawsuit if you feel you were damaged because of bad care versus the millions of dollars that are spent with attorneys fighting attorneys, if you have that view, that needn't be adding money to the system. That wasn't a part of the bill and the law, but hopefully there are still pilots out there and we'll get to that.
Okay, thank you very much.
I just was wondering if you could clarify two things, and you started to clarify regarding the exchanges, but my understanding of the exchanges is basically more like an information exchange, where it's just helping you to join with a pool of people that's already out there to pick a particular plan. It's not a government plan. It's a particular plan offered through Blue Cross or Regents or whoever, and just to join in with a group of people to get that particular plan so that you can get a group rate as opposed to an individual rate. Is that a correct interpretation? Can you clarify that?
Well, it's not necessarily that you join with a group. That's there for the small businesses to join together and pool. But you still go in as an individual and you say, you know, this is what I'm looking for and this is what I want to spend, and you'll have an array that's presented to you. If you have the tax credit, you have to go into the exchange to do that. But there will be plans outside the exchange as well. So there will be rules that come forth from the exchange board in Washington that will say what has to be offered in the exchange, because there's going to be a lot of money there. There are going to be a lot of people coming in with those chits. So there are going to be some plans that are called bronze, some that are silver, some that are gold, based on the contents that have to be offered inside the exchange. Less restrictive potentially outside, but you will be able to go inside the exchange to purchase, review what's available, as well as what's outside the exchange. If you have your tax credit, if you're at a certain level, you have to go through the exchange, so that there's a restriction on that federal dollar.
And is the tax credit a credit on your taxes that you file in April, or is it a coupon that actually can only be spent buying the insurance?
We'll see what the exchange comes up with.
Okay,
There's
that's
some
fine.
latitude, I believe, there for them.
Okay, thank you.
Welcome.
Hi, I'm excited about the new law. 3 years ago, I was pregnant with our daughter, and I had a pre-existing condition, which was that I was pregnant. And go figure. But my question is, I'm currently married with two children, and in order for me to have health insurance, my partner and I have to pay $500 each month just to add me on to the insurance plan. So I'm the only one in the household that's uninsured. And I wonder how this law will change for me as an individual and being married.
You'll have more choices come 2014. And you'll have more open choices because this will be competitive. It's like going to the Pike Place Market or something. You'll see which apple you want to buy, which pear you don't want to buy, which banana maybe looks even better. You'll have many more choices. And insurance plans now that are kind of undercover a lot, only offering plans through employers, and often you don't really know what the choice was that the employer had. You only know what the employer brings to you if you have that. You will now see these choices. There will be much more transparency. And because of that, the plans are going to be competing against each other. So they'll want to say, buy my apple, take my banana, go for that pear. I want you to have this pear and I'll throw in the apple. There's going to be a competition. So you will have many more choices.
Thank you.
I'd love to get your name because you have a great story. And as things heat up, you will hear lots of misinformation about mandates, about pre-existing, about discrimination, about whatever people want to say is or isn't in the law. And you cannot tell someone like this woman, no, that didn't happen. When you start with a story of, I experienced this before the law, and now I have this, you can't say, no, you didn't. So that's truth. You tell truth to power, truth to the law, and I'd love to get your name.
Hi, I wonder if you could talk a little bit about the political and legal challenges that are being constructed against the law, and particularly here in Washington State, and also your sense of how this will go and maybe how it might impact the election.
Well, yeah. Wish I had that little, remember the black ball with your pajama parties, dating myself again. You'd ask a question and it would say, not likely. Will my boyfriend ask me out next Friday? Remains to be seen. So I don't know. I think it's fought. The Supreme Court is the Supreme Court. It's scary to be there because there isn't any super Supreme Court to appeal to. But I don't have the numbers with me, but a number of the lawsuits getting us to that level. Some lost, some didn't. It seems that a lot of lawyers, which I'm not, have said the precedents are looking hopeful for the decisions prior to what those lower cases were decided, that you can't just ignore them when you get to the Supreme Court. You have to take those under advisement and see what was led and left to you, dealt to you. So there's a lot of optimism about that. It seems to me, I see less and less about who should recuse themselves and step aside because they had something to do with something related to this earlier, but that seems to have gone away. So I think the votes still will be there. I think it will be good to get it behind us in March, and who knows what it will be. There are many different pieces to it. They can decide all of the above, some of the above, just the mandate, just the severability. Does the whole law have to be dealt with or just pieces? All of that is why I'm not a lawyer, but I think it will also be interesting to see if they televise this. I think that still has not been decided. If we all get to watch how this gets talked about, who asks what questions, and how it's dealt with. So it's, again, transparent for all of us to see. But I have no idea, but I think we hope for the best. We continue with the sense of confidence that lower courts have provided us, and the traction in a political atmospheric sense with stories like you heard today or you yourself have experienced. It's hard to separate what's in the air about hundreds of thousands of people who've gotten the donut hole check, who've gotten this, that's not a good thing. And if you have a sense, if you're sitting up there in one of those robes to think, well, if I'm on the fence, what am I going to do? You hope, I hope, they think about as much about the lives I mentioned before at stake as about the letters or the words. Not a good answer, but I don't have one. I think we're almost out of time. Is there one final question? Maybe another story? I love the stories. Did you have, yes?
How many pages is this bill?
Oh, it's over 2,000. But 6 words. Remember the 6 words? Okay.
Right care, right time, right place.
You got it. All right. Well, thank you very much. Appreciate it. Oh, my handout. Let me just hand these out.
All right, do I have my sexy microphone voice on? Okay, I want to thank you for not only your great knowledge that you bring and your enthusiasm with it, but also I appreciate that you know our area, that you're familiar with our people, Kreidler, and you referred to Harborview. It just shows a commitment on your part, and I appreciate the time that it takes to share all of that with us. Thank you.
Hi, and thanks for coming, and I appreciate the information you've garnered. I'm kind of in the dark. I'm not really savvy about the healthcare system because I've never been able to afford real insurance for the last 30 years. However, a couple of years ago, I was under a state plan. I had contracted hepatitis C, and I was going through a series of biopsies, tests, and I was scheduled to go through interferon, and the state dropped me from the healthcare. Budget cuts and all that. I don't know why exactly, but that's my guess. And I don't know where I'm going to fit in the whole scheme of that, because I'm not under an insurance plan. I don't qualify for state or any other kind of health care. Where would I fit in, do you think?
I'll give you that number again. There's a pre-existing PCI pool, a little pricey, but if you need to get something taken care of, I'll give you that number to the insurance commissioner, and they can put you something on.
That is that 1-800 number you gave us, right? I wrote that down. Thank you.
Hi, I'm Danielle. Thank you for coming out and sharing that information with us today. I currently, of December 31st, 2011, got cut off my medical through DSHS because I get unemployment. And right after that, I found out that I needed to go see a specialist. So if anybody doesn't have medical and does need to go see a specialist, I found a program which is called Project Access. And Project Access will help you pay your medical bills if you're low income and don't have it. For anybody here who might be in the same situation as me. So your information helped me feel a lot better about hopefully getting medical back, because it is so expensive and I can't afford it. Thank you.
I want to thank you for being available and coming here today. Many times other colleges or institutions are more the focus of different speakers that could be incredibly useful and valuable to us as you were today. And as an older person, I loved your references to Parcheesi and Magic 8-Ball. You made it very understandable, and thank you for your personal information about pre-existing conditions. Thank you for coming and giving us that information.